Mr. Stefan Gantner, it's an absolutely pleasure to finally meet you after so long time. I started treatment for your both legs 28 and a half years ago, and since you started your puberty, we haven't seen us so for a long time. My question to you, what happened to you since then?
So if I remember correctly, it was 2006 when we last saw each other. I was 12 years old. And what I remember perfectly is after this time, I was fully able to focus 100% on my school time. I remember every field trip I took, and therefore I'm so grateful for what you did, your work, the surgeries, because this means quality. This is quality to join sports events and all those kind of activities. So I'm very thankful for that. After I graduated from high school with a diploma, I traveled to the US for the first time. I stayed in San Francisco for about 6 months, and I visited a school over there to improve my English. It was a great experience with 19 years old, it was the first time away from home, and I did not know what to expect, like questions like the orthesis. What if something happens to the orthesis? There are no specialists over there. What can I do? But I focused on the bigger picture, on the school, the great time, the culture, and it was a beautiful experience. And back home, I then started my career with a first job. And 2 years later, I joined another company, international company, and they gave me then 5 years in the opportunity to move to the US again in a new plant with new opportunities. And this was the second time I was able to travel abroad for 2 years, 2 whole years. And this was up till now like the biggest adventure I ever experienced. I also I get my driver license when I was 21, and I'm basically driving with gears. So no automatic car, driving by gear. Like I always like the challenge, the tougher way. And I joined the fire department when I was 14 years old. So they have like a youth firefighting group between 12 and 16 years. And from 16 on, I became an active firefighter, which means I am able to join operations, during emergencies. And I even drive with the whole crew to the location, to the spot. And this is pretty impressive, looking back on everything we went through and all the surgeries. I think 19 in total. That's very impressive, and I'm very proud of that.
I'm proud of you as well. It's amazing what development you took. It's unbelievable. And what is also very impressive is that you don't hesitate to go abroad, and to travel on your own to America and even working there. I mean, this is amazing, and this shows that you are a tough cookie.
Yes, sir. That's true.
And
That's
I can tell you, I know why. May I ask you, and I come back to this later, may I ask you, what do you remember from the treatment itself?
the last one in particular.
No, what you know of all of it. So
All of it.
what are the main memories you have out of it?
Mm-hmm. Mm-hmm.
Honestly.
Yes, of course, of course. I remember, of course, only the time in Aachen, in Germany, because
Yes.
Heidelberg was too soon, obviously, right? I was a baby, a toddler.
Yeah.
In Aachen, I have quite some memories, especially also the visits during, like the control visits every other year
Yes.
after the surgeries. But the surgeries itself, I do not really have any memories. I remember playing with kids on the hallway, and there was one huge carnival event. That was something very exciting, I remember. But other than that, unfortunately, I do not remember. I know, however, by now that kids are the strongest of us. Kids have such a huge resilience, And
Yes.
this is something I remember the last surgery. I remember I wanted out of the bed after surgery, maybe 1 week or a couple days after the surgery. I just wanted out of bed. I wanted to walk, I wanted to play. And there was an adult in another room next door. And while I was already on my feet walking for at least a week, he was still lying in bed.
Yes.
And too much thinking,
Exactly.
Yeah.
Exactly. Yeah, it's interesting and wonderful what you are saying, and it fits exactly to that what I have found out through all the years of treatment. You was also responsible for the fact that I did a psychological study, and I can tell you why. In one of the surgeries we did, when you wake up, the anesthetist is asking the patient, and this was you, questions, what is the name of your mother? And there was no answer. And I was standing there, and only by chance and for fun, I was asking, who did the surgery for you? And you said, Dr. Weber.
Ah.
And everybody was laughing, but I was thinking, oh, wow. When he was asked what is the name of the mother, and he doesn't say nothing. When I asked him, who did the surgery on you? He said, Dr. Weber. I must have a huge impact on him.
Worse.
So, and I wanted to know, okay, what is it, what we do, what I do to the children with these multiple surgeries, and do they have any negative effect? And we studied it together with the psychological department, youth department in Aachen at this time, and we had different groups, different age, the very young, the middle, and the older ones, and we checked all of it, and what we find out at the end was what you just tell me as well. All of them have no bad memory. None of them has any psychological issue after the treatment. None of them, without any exception. And some of them were saying it was not an easy time, it was a hard time. Some were saying, I actually didn't want to do it again, but I'm so happy with that what I have now.
I agree.
And this is a very realistic and honest situation. And for me, it was the utmost importance that none of the children, also later we had a longer study, developed, and also the parents developed any psychological issues. Just the opposite, due to the fact that they were much more disabled before the surgery. Some of these psychological issues like a minor complex and all these things disappeared. And they became very strong personalities.
Yeah.
And this happened to you as well.
The word I have in mind is, again, life quality. You give people life quality back. As you just mentioned, they were in a terrible condition, physically, and you make it better. That's the goal of the surgery. So this is, life quality.
Yeah, this is a very important point, and I would like to tell you your story more in detail in form of a presentation, and then I come back to some circumstances, how you found me, or especially your parents. So if you are ready, I would like to start with the presentation, because I remember also in one of the Zoom meetings with other people, with Mr. Holzknecht, who published a wonderful book called Perfect, pictures of people who have any kind of disabilities. And this is a wonderful book. I would have loved to have one of those. But I saw the picture from you, and in this meeting you were telling that when the people are asking you, what do you have, I even don't know it.
Exactly. Yes.
And let me help you with that. I can tell you exactly what is the disease and what are the different steps you went through.
I'm very excited.
I will tell you also why you are my superhero in many ways. So,
thank you.
Let's do the presentation. Weber booster and transformation surgery for tibial hemimelia, and you have two different forms. On the left side, not so severe, but on the right side, very severe. And let me explain you according to my classification what this is. So there are in total, it's all tibial and mammalia. There are 7 different forms, and from type 3, there are 2 subtypes. Type A is with cartilaginous Anlage, as you see here, and type B is without cartilaginous Anlage. From type 1 is the less severe form, and type 7 is the most severe form. Okay? And you had on your left leg this type 3A. That means the part close to the foot of the shin bone is missing, but there is a cartilaginous Anlage. And on the right side, you had this form, absolutely no tibia, but you had a patella. So let me show you first, starting with this left leg, what I did with it. But I have to tell you also why it's very important for me to tell you that, is that you are the first patient where I detected this cartilaginous Anlage. Here, this white area, this is a cartilage formation, which you can't see in the X-rays. And at this time, nobody did any MRI. So because I detected this one, I did an MRI, and this is the picture of it. You see here this dark area, this is cartilage. Yeah? Mm-hmm. And my idea was, okay, if there is a cartilage, then we have to bring the cartilage into contact with the food. And maybe we get a joint out of it. Yeah? Because you wouldn't have had a joint if it was without this cartilaginous Anlage. Yeah? So this is the situation. This is the cartilaginous Anlage. So because of you, yeah, this is a foundation of my classification with cartilaginous Anlage. And this is, nobody in the world did know about this cartilaginous Anlage. Yeah? So I was the first who described it. And you are the patient why I found it out. Yeah? So, and this is your leg. We focus now on the left one. You see here on the X-ray only a piece of a shin bone. And look what happened. Here's the defect. The fibula, this is the other bone in the lower leg, is bowed, is crooked. And look at this. 5 years later, it looked like that. 7 years later, it looked like that. And this is like a normal lower leg. So what is the reason for this exceptional development? I can tell you, I did the surgery, because normally, if you don't do nothing, this will happen. Yeah? This is a picture of a child who didn't undergo any surgery. So, and the fibular bone stays bowed, yeah? And the rest of the shin bone atrophies. That means it gets slimmer, 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 and smaller, and is not used for anything. And there is no knee joint, and there is no ankle joint. Yeah? And the whole thing is very short, very close. You see here the foot is very close to the thigh bone. Yeah? So, and what was the procedure? I show you. The procedure is, this is the cartilaginous Anlage. This is the gap between the shin bone and the foot. And the first step is to cut through the bony part of the shin bone, means like here. And then we can do a lengthening. With 1 millimeter a day, we can do a lengthening and shifting of this bone cartilage fragment to the foot. Yeah, and this can be done, this is a usual technique, it's called callus destruction. That means with 1 millimeter a day, we can destruct it. The bone wants to heal, and this fracture callus, with like a fracture healing, is a soft tissue, yeah, and you can stretch this, can lengthen it, yeah, and all the surrounding tissue is lengthening as well, so that's why you can bridge all this gap until there is a contact. And at the moment when you have a contact, some miracle happens, yeah, you even get a growth plate out of this cartilaginous Anlage. Growth plate are the areas where the bone naturally grows. So you had this already from the knee joint part, yeah, and here you got it also from the cartilaginous part. So this is a complete new surgical technique based on the endeavor of a cartilaginous Anlage, and you are the first worldwide where I did this technique.
Wow.
And we got for free, so to speak, due to this stretching and lengthening procedure, that their fibular bone straightened out by itself. Yeah? So this was the situation when you was 18 months old. We are talking about this leg. This is how it looked like. And this after the first surgery when you was 2.5 years old. And then you was already starting to playing soccer. But this was already after I have done also the right side. We come to the right side. But first, let me explain to you, according to my classification, all these types here have cartilaginous Anlage. And with this cartilaginous Anlage, I can construct a knee joint or an ankle joint. And this is wonderful, because then you have also functional joints by using that. And worldwide, they didn't know about this. Until now, they do amputation, although there is an easy way to create joints. So with this, the maturation, that means the growth of the cartilaginous Anlage with development of a growth plate where the bone can grow on itself, is the effect of this callus destruction, where we do the destruction of the bone, and the stimulation due to the weight load. At the moment when you walk on it, it gives also stimulus in order to develop proper tissue with own growth. This is called form follows function. So once this cartilaginous Anlage is in contact with the joint, it becomes a joint partner and a self-growing bone segment. And nobody knew about this one, so we found this out together, Stefan. Yeah, so now let's come to the more complicated part. This is your right leg. This is the situation, no cartilaginous Anlage. There's only a foot. There's only a fibular bone, that is a thigh bone. There is no knee joint, and there is no connection of the foot to any of the bones, okay? And worldwide, all these children got amputated. And they got amputated here at this level. It's like an amputation in the thigh bone. And this has severe consequences. Mm-hmm. And what I found out is that you had the kneecap. And I was thinking about this for several reasons, how we can use this kneecap to create a better function. As you see here, this is my score system. I have it for any of the children. I have done the surgery. Meanwhile, over 200 limbs, I did the surgery. And when there is a kneecap, automatically this type becomes much more treatable. And much from the classification, you jump minimum 1 class better, sometimes 2 or 3 classes better. So this is a very important structure. And I did a special technique with this kneecap, and this was awarded twice from the German European Pediatric Orthopedic Society. And let me tell you also the circumstances how your parents found me. I think this is a very important to tell you. So this is the situation. You came to me, both upper limbs affected with radioclapant and both legs affected with tibial mammalia. And when your mother came to me, your parents came to me, they were telling me a story I couldn't believe. They were telling me that the obstetrician who brought you to the world has said to your mother, who just delivered you, this child should have not been born. And this, I was shocked to hear this. But what was the effect? The effect, your mother and your parents was, they were triggered, and they said, now I will do everything in our ability to give my child a better life. And they were searching, and they came to us, to the University of Heidelberg, to the biggest center for this kind of malformations, and they found me. And I was also triggered by this by this comment of the obstetrician. And I was telling your mother, I don't know yet what we can do, but I will think about it and I will let you know if I have an idea. And interestingly, a week later, I had booked a ski holiday in Austria, very close to your home. And when my friends were skiing, I started very early to think about it and went home to the hotel earlier as them. And even in the chairlift, I was thinking about your leg and how could it be solved. After 7 days, I had the idea and I made a plan, and I can show you now what I did. And I explained it to your mother, and I told her very clearly, and to your father, this has a very good chance that it's working. I cannot promise you. This surgery has an experimental character, but it's the only chance to give you function. And if it fails, we can do amputation anyways, but at least you have a chance. And your parents trusted me very much, where I'm very glad up to now, and we were successful, as you know. So this is the situation. Let's come back to the picture. Here we're talking about the right leg, and here this is the fibula. This plays a very important role. And to see the size, you see my index finger, so very small. Mm-hmm. So in the first place, we had to apply a plaster to make the joint straight, and then you got a mini ring fixator, yeah, on the thigh bone, on the fibula, on the foot, in order to do stretching of the soft tissues only. Yeah, so this is about 8 centimeters in total, in order to bring the fibula under the femoral condyle, so under the thigh bone, and the foot under the fibula. And then this is the trick. I don't go too much into details. I just want to show you what is the background of your knee joint on the right side. You have a kneecap, you have the tendon which is connected to the muscle, so the kneecap can move. The blue part is the capsule of the missing knee joint. Yeah? So what I did is lengthening of this tendon in order that I can bring the patella down. Then I did 3 incisions through this capsule without completing the incisions on the medial and on the lateral side, yeah? On the outside and on the inner side. So I have 2 flaps. Yeah? And these 2 flaps allow me, like in the visor of a helmet, you know, motor helmet, to shift these 2 parts towards each other. And with this, the kneecap, which is on the upper part, yeah, here is the kneecap, comes under the femoral condyle. Yeah, and this is the whole trick of the whole situation. So I can twist the whole thing towards each other, and then I have a situation. Here the quadriceps tendon is still connected to the kneecap. The kneecap is now joint partner of the femoral condyle, and the fibula is inserted into the kneecap. The fibula is working as a shin bone, as a tibia, and the kneecap is working as a joint partner with the motor from your muscles. Yeah, and this is the innovation I've made, and I showed it to your parents, and they were impressed and they trusted me. So this is the lengthening we first had to do. Then we bring the fibula bone under the condyle, and here the foot under the fibula bone. Then we stabilized the foot with bone skin, this periost called, and then here the patella, which is working now. This is now a knee joint, and we can stabilize it also with a ligament inside. So, and this was the situation 1 year after the surgery, and you can see already, here's my index finger. So your fibula has grown tremendously. Yeah? And this is also the benefit when you do these surgeries in children. Form follows function. That means give the fibula the function of a shin bone, and you receive the adequate form. Yeah? And this is the reason. This is also an MRI, so we look from the side, and this is the thigh bone, this is the fibula bone, here is the quadriceps tendon, this is the tendon inserted into the kneecap, and the kneecap and the fibula is already fused together. Here, this is the joint space, so it looks like a normal joint. Yeah? And this is 7 years after. Looks like a normal tibia, like a normal knee joint with growth plate and everything. Yeah? So it worked out very nicely. This was your situation 1 year after the surgery. You see both legs are treated, okay? You can bend your right knee up to 85 degrees at this time. I don't know if still the same or it has become better. He was even able to walk on the right leg. I first started with the right leg, which was the most severe one, and then did the other leg. And you could have full weight bearing there. This is 5 years after the surgery. You could bend it very nicely, could extend it very nicely. And this was is a video, 7.5 years, how you are walking with the orthotics. The orthotics are only braces from outside. These are not prostheses. Yeah, your whole leg is inside, only to support your growing joints, which we have constructed, which was not there before. And you see, when you were walking faster, it looks much, much more versatile as if you walk slowly. Yeah. So you could see already you like to walk fast or to run. Yeah. Mm-hmm. So, and these were pictures I got from your mother showing that you were very active and you spoke about it. Huh? You were skiing, you did a husky thing here. I'm jealous, I never did this by myself. And here, this sliding, you were not afraid of anything. You know, you slide here with this hanging rope and you played soccer. Yeah? Yeah. So this was very nice for me to see how you developed and give me a lot of satisfaction. Yeah, so we came from here, you see here with a fixator, then 2.5 years you played soccer and you spoke about it, you became hobby-wise a firefighter beside your job, yeah? And you were speaking about not going the easy way, yeah? And we both didn't go the easy way, yeah? You have to go through something together with the surgery with me, and a lot of doctors are telling me also, why don't you amputate it then, finish, it's done, why you go so complicated ways? Yeah? And I can tell you why. Because number one, amputation is not the end of a treatment, but the start of a lifelong prosthetic fitting. And this can have a lot of disadvantages. Number one, walking is only possible with the prosthetics. And if you have prosthetics on both legs, even when you wake up and have to go to the toilet, you have to put your prosthetics on. You cannot walk simply to the toilet without. Yeah? Or phantom pain. Yeah? If you do amputation, you always have to consider that patients can become a phantom pain, especially in adults, where they feel the missing part who was amputated very painful. And this can lead to severe psychological problems and up to that people kill themselves because they cannot bear the pain anymore. Or stump piercing, especially in children when you have done an operation, that the bone can pierce through the skin where you normally want to walk on it. And it can lead to wounds, and the wounds can lead to tissue infections and to bone infections. You know, in the department where I was working in Heidelberg, I was also responsible for all these amputees. And I know what I'm talking about. It's not easy going. Yeah? You can have a lot of problems with the prosthetics and with the skin and everything. And what a lot of people and doctors even don't know is when you have, for example, which would you have had on your right side, amputation at the knee level, you have an increased walking effort of 200%. So you have to be 200, you have to work 200% more in order to get walking. And in your case, would it be 300% because you might have also prosthesis on the left side. Also, you have no sensitivity at the prosthetic foot. What is the disadvantage of that? You have severe difficulties, people with prosthesis, to walk in dark, because they easily can stumble over small obstacles like carpets. They always have to control the walking with the eyes, so they need to see where they are going. And what a lot of people don't know, amputees don't live as long as normal people. Yeah? They have a reduced lifespan. So there are only a few examples why it's much better to have construction of the limbs and to not to go the easy way, yeah, also for a doctor, to cut it off and that's it. Yeah? Let me show you another video which I made after we have removed all the fixators, and this is the first time in your brace, and you were walking, and as we know, you can run better than you walk slowly, and this reminds me very much on the movie Forrest Gump, multiple Oscar-winning movie, where Forrest was also disabled and had to use braces, and from running away from the mockeries of the other children, he found out that step by step he is losing his brace. Yeah. And this is an amazing video for an orthopedic surgeon who is treating a lot of children.
Such a powerful scene.
Absolutely. Yeah, and you wouldn't believe if I told you that most of the children I've treated, and also adults, lost their braces while running through their lives. And I'm very happy about that. Wow. So I published these techniques in 2 books, also other problems, and yeah, I thank you very much that you take your time and listen to it. And if anybody is interested, he can book a consultation with me under this number. So let me know how you liked it.
Thank you for sharing all the knowledge, all the experience. I really appreciate that, because you just mentioned in that podcast with Christian Holzknecht, I shared a story where someone asked me, what is it what you have? And over the last 30 years, I never saw myself as handicapped. I always knew I have something, I am handicapped, but I never felt that way, right? So I told that person, you're right, there is something, but I unfortunately do not know. And this person, he was from a medical department, I assume. He said, yeah, but there has to be a name for that. And I told him, you're probably right, but again, I unfortunately cannot tell you what it is. So this is very interesting, and thank you for sharing everything with me here today.
Yeah, it was a great pleasure for me. And as I told you, if you think how children develops, yeah, and I find out that those children who have it super easy in their life might not become the personality which is strong, and maybe they are not this strong character. Yeah? And what I experienced with you here and with all the other children, without any exception, they become very strong personalities, very super smart. They made something out of their life. And as you said, yeah, there is no obstacle for me. And if someone is saying, I can't do that, I just do it. And this is because you experienced so much hurdles in your young life that what shall come worse. Yeah? You have experienced already so many difficulties and you overcome it very well, yeah? That you have also self-confidence. Yeah?
Yes.
And let me come back to this obstetrician. Actually, everything has a meaning in life. And I think even this negative sentence from your obstetrician has something very, very positive. Number one, it triggers your family to give you the opportunity of the best treatment. It triggered your surgeon, because I was also very much negative impressed by this, yeah, to find the best solution. Nobody knew till now, and I had to invent it. Yeah? And I have to tell you also, how does it work when you do a new surgery? You simply cannot do a new surgery. You have to defend it, and you have to present it, especially in Heidelberg, in front of 30 doctors, 10 consultants, and 1 director. And tell you the story also, when I presented what I want to do with you, the director was saying, I didn't understand what you tried to do. Please come to the front and paint it on the paint area what you try to do. Yeah. And then I painted as why you don't send the patient there and there? You know, there was just a colleague who become head of a department close to Austria. And I told, yeah, these parents came to us because they wanted the best treatment. So I had them in the pocket. And then he said, I still don't understand, please explain it again to me. I explained it again, and then he said something which I also will never forget in my whole life. Yeah, he said, Dr. Weber, I still don't understand what you are trying to do. You give me the impression that you exactly know what you do, and I wish you good luck.
Wow.
And this is greatness.
Self-confidence as well. Self-confidence.
This is, and you need to know at this time when I did this was in the 90s, yeah? The head of a department was like a king. And what did he say? He did say, I don't understand what you do, I have no clue, yeah, but you give me the impression that you know what you do, I wish you good luck. In most of the other hospitals, no head of a department would do that. He doesn't want to put himself down and put someone else who even is not a consultant yet, put him up. This is also has to do with self-confidence. He was the big boss in whole Germany, and this was great. And I was very much happy to send him, after I got these 2 awards, a letter that I appreciate very much his support. And this was also part of it.
Yes.
Yeah?
Yes.
So,
yes.
and I mean, all this combination, this triggering from the negative sentence from the obstetrician, strong and very supportive family, strong and very compliant patient, yeah, support of my director, and some good ideas from my side. All this came together, and we end up in a wonderful success.
Beautiful story, isn't it?
Yes.
You mentioned earlier the word trust several times and self-confidence also several times. And if I think back over the years, many people ask me, how did you do that? Everything, literally, the traveling, the volunteer fire department, and so on and so on. And thinking back, it's exactly what you just said, right? My parents went the hard way. They chose the hard way. They trusted in you, right? You also trusted in them, in yourself, in your technique, the strategy behind it. And the answer to the question earlier, why I am who I am, is exactly this. My parents, gave me this trust, this self-confidence. And if I now, and I cannot even imagine what they imagined, when they saw me when I was born, and these 1.5 years, the 1.5 first years as a toddler. But I can tell now that, yeah, everything I did was because of them, and also because of you, right? You just mentioned it. The characters of the kids who went through this very tough time, they are stronger. And my understanding here is, and I do not say that this is like for everybody, but my understanding is we always have to give at least 150% to achieve what others with no such condition achieve in normal life, right?
Exactly.
That's my understanding why I am where I am. And things, especially in life, they become easier if you have to give 100%, 150% all the time, because you decide quicker. For instance, I focus on the bigger picture all the time, and all those tiny small problems, issues, topics on the state, they just become smaller. They don't disappear, they just become smaller, right?
Yeah.
And I think that's my key. That's my key. Not everybody's, it's mine.
What just came into my mind, we had another support, which I forget to mention, and this is the moon.
The
Yeah?
moon's
So,
casual. Yes,
yes,
yes.
so your mother asked me to schedule the surgeries to a special moon phase. I said, no problem, I will do that. And you see, all of them helped to a great success.
Exactly. Yeah, it was successfully.
Yes. So you mentioned also that you have a new orientation, that you are working with functional psychology. So
Positive psychology. Yes, sir.
positive
Yes.
psychology.
Yes,
Yeah.
yes. Yeah.
So what
So
are you doing there in what is the specialty of this?
yeah. So I would like to focus on my part, not just the positive psychology, which was first named by or first mentioned by Martin Seligman in the US around the 2000s. So it's a very young area of psychology in general. And in 2023, when I moved back home from Arizona, from the US, I got asked by a friend of mine, a woman, if I would like to share and give confidence to other people with disabilities. And my first thought was, how can I do that? And I remembered that a young gentleman in the US already told me, Stefan, you inspired me. And at this point, I knew I already did it. It's just a
Exactly.
question on how can I continue with it. And the second thought after that was, why only people with disabilities?
Sure.
We all should have the opportunity, and to be inspired. And even in movies or theaters or whatever it is, we got inspired by people with a story. So last year around this time, I turned 30 years old, and I decided that my purpose in life is to share my story with the world, to inspire people with authenticity, with pride, and also with self-confidence and trust. So this is basically what my future plans look like, and I'm very excited where it leads to. I'm at the beginning, and I'm very excited because this comes from the heart. This is a heart thing.
And I can assure you, you are predestinated to help the people, and especially with your story. And now you have also more material you can use to show the people what you went through and what you have overcome. And you are a hero in this to overcome all this. And you are also in the medical field, yeah, someone who helped to get a better classification, better treatment for others.
Mhm, mhm. Exactly. That's true. There's one thing I would like to share a message, if I may.
Sure.
And I truly believe that everyone has, like a fire deep inside. And this fire symbolizes maybe a dream, a vision, or maybe even a goal. And this is also part of my goal, or my mission, if you will. So to help focus again on this inner fire,
Yeah.
right? As I mentioned earlier, the things on the side, they become smaller. If I just give you an example, people ask me when I travel to the US, they ask me, "Oh, do you really want to fly by yourself? Aren't you scared?" And if you look at the bigger picture, then the flight is like the teeny tiniest topic of the whole journey, right? But people get confused and people get like, too much concerned about those small things. And then you miss the opportunity of that bigger picture of your wish, your vision, right? And therefore, I think, and I would like to encourage people, to sharpen the focus on the bigger picture. And if I can do it, you can do it, right?
Exactly. Amazing. I'm so much amazed what you have become. Congratulations.
Thank you.
And it gives me great satisfaction that after all this year, everything is functioning very well. And I thank you so much for this kind of meeting and interview. I have learned a lot. And
I did too.
Again, many greetings to your family and all the best wishes. And we should keep in contact.
Of course. I'm also very grateful for everything you did once again. And I am very glad that I reached out to you after all those years. Also to give you an understanding what I did, my story, and that also you can also be proud. It's a very great accomplishment. Thank you, sir.
A little bit, yeah.
Thank you.
Okay, thank you so much.